So what is the coronavirus? And why is it different from past outbreaks? On December 12th of 2019, the world received its first case of COVID-19, otherwise known as the
Coronavirus.
The coronavirus.
3 months later, COVID-19 had infected over 100,000 people and killed over 3,000 civilians around the world. While the world has seen the coronavirus family before, medical experts have never seen a case like the current COVID-19 outbreak.
The virus, which is now known as the coronavirus infectious disease 2019, it's a new virus. It is obviously spreading rapidly now out of China, elsewhere in the world. There's still uncertainty about just how lethal this virus is.
The COVID-19 outbreak isn't the first time in this millennia that we have feared a global coronavirus pandemic, and it is not the first that originated in China. Back in 2003, the residents in the Guangdong province of southern China fell ill from SARS, a strain of coronavirus believed to have been transmitted through infected bats and civets. The epidemic spread through 26 countries and infected over 8,000 people, of which about 800 died. Many blame China for its slow response time after attempting to hide the contamination from the world. Scientists see similarities between SARS and COVID-19.
They're respiratory viruses, so it means that the transmission is enabled by people's coughing, sneezing, contaminating their hands, and then putting their hands to their mouth or to their eyes. So the route of transmission appears to be similar.
MERS, another member of the larger coronavirus family, emerged in 2012 in Saudi Arabia and went on to rack up 2,494 confirmed cases and 858 deaths. Coronavirus seems to be more contagious but less lethal on a per-infection basis.
It looks like it's actually spreading more efficiently between human to human, more effectively than SARS and MERS have shown in the past. However, it also looks like of the people who do get infected, that the percent who experience severe outcomes or death is lower than what we saw with SARS and MERS. Given what we currently know about the virus, especially new information we're finding out that people may be able to spread it even before they show symptoms, this indicates that it is likely to be much harder to control than had been initially expected.
We know from historical examples from SARS, from MERS, from other emerging diseases, that this kind of event, particularly where there's a pathogen that spreads through the respiratory route, really can disturb public confidence. In prior outbreaks in MERS, for example, there are these kind of iconic images of people traveling the subways masked, and of empty movie theaters, kind of places where people would ordinarily congregate, do business, travel, being emptied out because of the kind of invisible threat that could be circulating.
When we think about whether or not we will react appropriately and proportional to the risk, our recent track record isn't very good.
I fear personally that the U.S. is more at risk than in Italy or in Germany. Best case scenario is a few hundred dead in the United States. The U.S. has a very large public health budget, a substantial public health infrastructure. Last 2 or 3 years of the Trump administration have seen some combination of erosion and deliberate dismantling of much of that infrastructure, but much remains in terms of the public sector capacity. But then we have the private sector phenomenon of people who can't afford not to work, who can't stay home with their kids because they can't afford the income loss, or they can't go to the hospital because they can't pay for the hospital. So you see potentially a downward spiral of greater economic impact leading to acceleration, potentially, of the pandemic.
Dr. Redfield, does the CDC agree that this is a problem that is going to go away without intervention?
I think it's prudent to assume that this pathogen will be with us for some time to come.
The world has been hit by a handful of global outbreaks in the 21st century. So why are we never properly prepared? And why are we always surprised?
We should not be surprised. The timing is always a surprise. The exact location might be a surprise, but we know that Asia is a high-risk area for this type of virus to emerge. It's important to emphasize that each time one of these events occurs, we have to productively harness, without fear-mongering, but productively harness the attention it generates to put pressure on decision makers to make those investments in basic science, in development of vaccines and therapeutics, in investing in preparedness and surveillance and response. It's an enormously difficult problem, but it's a problem that can be solved.